Hi, I'm Brian Finestein, CEO of St. Clare's Health. Welcome to Let's Talk Health. I'm here with John Cronin, manager of our EMS service, and our topic today is 911. Our goal in this meeting is for you to realize what is it you need to do when you're calling for 911 to the emergency medical team. So John, if a family member, someone that you know, needs emergency medical services and calls 911, what do they need to know?
So they need to know where they are, first of all. That's the most important part, because when they call 911, it gets routed to a local PSAP center, which is a dispatch center in their town. And then the dispatcher will figure out where they are, and the most important thing is, after that, is a contact number in case they get disconnected. And then there's a series of questions that they'll have to ask to answer to get the appropriate response.
John, first responders, do they all have the same training?
No. So there's multiple levels of first responders, and in New Jersey it's a two-tiered system. So there's basic life support, which are EMTs or emergency medical technicians, and they have the basic life, they're the first response, oxygen, first aid, CPR. Then there's the advanced life support, ALS, or they're called paramedics. Basically, they're the first 30 minutes of what you would see in an emergency room. We have cardiac monitoring, IV medications, intubation supplies. We can start IVs in the field. We'll start the first half hour of your ER visit in your living room, in your car, in the ambulance, on the side of the road, wherever you need it most.
Now, when you're on the road, you see a lot of different ambulances. Are they all equipped the same?
No, they all have the bones. They all have the same bones. And then some are advanced life support, which we'll show you in a little bit. And then some are basic life support, and some even have nursing supplies on there.
So let me ask you something. So you have these responders, and they may be EMTs, paramedics. What are the steps that they're taking once they get to the scene?
So the first thing first is they're assessing the safety, because we don't want any of our responders to be going into an unsafe scene. The second thing is they're taking in everything. How is the patient look? How is the patient acting? What's going on? We'll ask surrounders, bystanders, family, if is this normal for the patient? And then we'll get to the root of the problem. When did it start? What's going on? And then we'll kind of take steps from there. We'll take their vital signs, we'll listen to their breath sounds, we'll look at their EKG on the monitor, and we'll do 12 leads in the field, and then we'll make the appropriate course of action or treatment plan from there.
Now, are you in touch with the hospital during this time?
Yes, as paramedics, we have to make medical control. So when we do our assessment, we can operate under standing orders to a point. And then once we get to that point, we have to make contact with a medical control physician, and we call either Dover or Denville, and we'll have a conversation with the doctor, and we'll kind of come up with a treatment plan with them and then implement that on the way to the hospital.
Okay. Can we take a look inside the ambulance?
Absolutely.
So John, tell us about some of the equipment.
Okay, so now that we're in here, I can show you. We obviously have the stretcher, which is where the patient goes. This is for the paramedics. This is our med bag. We carry 60 or so medications that we can use at any given time. We have our cardiac monitor over here, which we can put on and do 12 leads in the field and diagnose possible STEMIs and other cardiac issues. We have our airway kit where we can manage airways with just a regular face mask, or we can intubate patients. No problem. We can even do needle crike if we need to with a surgical airway. And then we have vents and backup equipment in case there's more than one patient and the crew needs to split. And then all of our airway stuff is over here so that the person at the head can manage the airway. And anything that we need for like the body area is down that way, so it's easily accessible.
So you really are a rolling emergency department.
We really are a rolling emergency department, and that's good.
Now, are you also still in touch with the hospital as you're en route?
Yes, if we need to recontact the hospital, it's not a problem. As a matter of fact, we do sometimes because, patient care, it does, once you establish a plan and you implement it, it can go one of many different ways. So if we need to recontact the doctor, we can absolutely do that.
So John, besides obviously the emergency life-threatening services, what other programs do you run on behalf of EMS and St. Clare's?
That's a great question. So in the Emergency Medical Services Department, we also do what's called the Teddy Bear Clinic, where we go to the elementary schools in the area, and for the kindergartners, first and second graders, we try and make them not scared of the ambulance, because it can be a scary place. So we encourage them to bring their teddy bears to school that day, and we bring first aid kits, and we have them bandage up their bears, their boo-boo bears, and they get a tour of the ambulance so that they're not afraid. We also do hand washing stations, especially with COVID lately, so that's a huge thing. We do Boy Scouts and Girl Scouts. We'll help them with their first aid badges. And then we do community events. parades, fireworks, anything that we're needed to and we're called to, we'll be there for.
Thank you, John.
Thanks for having me.
Again, viewers, thank you for watching Let's Talk Health. For future events, please look at our Facebook and YouTube channels. And for additional information, please go on our website, www.stclares.com.